Hello, Nurse Bunny Hop. How are you today? Good, good. My name is Nurse McFarquhar, and I'm here to give this report. Okay, the report is on Mabel. This Mabel. Mabel is a 70-year-old female who came into the community clinic here earlier. She has report of rheumatoid arthritis beginning at the age of 50. Um, she is here for increase in pain in the hands, the wrists, the shoulders, and knees. So she's having a warm little time with that, okay? And stated that in the morning she has stiffness that hinders her from her activities. Pain rate, when asked, was 6 out of 10. Her medical history, she has a medical history of hysterectomy. She has 7 vaginal births. And she has a cholecystectomy. Pardon me for the pronunciation. Okay, still learning. As you know, even though we're nurses, we're still in learning. Okay, she has a family history. Generally, we don't give the family history too much. It's just the patient history. And the history, one of them is of rheumatoid arthritis. So there goes with that. So it's an understandable thing that she has that. Okay, meds. She's on medication, Enbrel 50 milligram weekly subcutaneous for 3 years. And she's also on the over-the-counter meds, ibuprofen 250 milligram PRN, naproxen 220 milligram PRN, and of course those are to help reduce the pain, of course. Alrighty, so her private physician ordered blood test, rheumatoid factor antibody, and the erythrocyte sedimentation rate, which is the ESR. Okay, also the antinuclear antibody, the titer, and white blood cell count to see what is really going on and how he can improve the medication, or up the medication, increase the medication to help her with her pain. Okay, so this is what he did. He decided that he's going to go ahead and give her something new. But before he did that, he went ahead and discontinued. Let me go back here. He discontinued, let's see here, the Enbrel and the ibuprofen. The Enbrel 50 milligrams, which that she's on subcutaneously for 3 years, and the ibuprofen 220 milligram. He's keeping naproxen. So this is it now. So the new medication is the Plaquenil 400 milligram once daily, prednisone 60 milligram 1 a day. Of course, still once daily. The Humira 40 milligrams subcutaneously every week. So what you can see here now is that since he discontinued the Enbrel, the 50 milligram weekly, he then started her on the Humira 40 milligram, subcutaneously every week. All right. So, as I said, the Enbrel and the ibuprofen, those were discontinued. He kept the naproxen. So what's going on here is that the naproxen that she was on with the 220 milligram PRN, now she's continued on it, but instead of the PRN, just PRN, he now has it for every 4 hours. Every 4 hours. Every 4 hours 220 milligram. So let's see here. I want to make sure that's right. Yeah, so he continues the naproxen 220 milligrams. So she's still on that, but the only thing is that instead of just PRN, it's every 4 hours PRN. Every 4 hours PRN. So that is it for Miss Mabel there. And she's doing, so far at the time when she was discharged, she was doing fine. She got the teaching, of course, on rheumatoid arthritis, which she told me she's very familiar with. But of course, that's something that we need to do anyway. So I did that, give her all the teaching again, or even try to just see what she did not know as yet or remember. So in which way I just do a little tutorial rundown on it. So she really appreciate that. So here, going back onto the pertinent assessment, you know, for example, the vital signs and the neuro, all those is not pertaining to this, you know, the skin and so forth in this context here as we're talking here. It's not, the only thing in here is the pain, which is 6 on a scale of 10. 6 on a scale of 10. And medications are listed. So that's it. If you have any question, you can let me know. Any question? Alrighty then. Well, you have a good afternoon and you try and take it easy here. Alrighty? Okay then. Thank you. Call me if you need me, but call me when I'm out the door, please. Okay then. Have a good afternoon.